everybody. Welcome. My name is Dr. Nayiri Gharibian. I am a Facey medical group physician practicing in Mission Hills, and I will be giving you all a virtual talk today on blood pressure and heart health. And I just would like to say on behalf of the Patient Education Advisory Committee, also known as PEAK, that I am so excited to be able to do this for you all in the midst of some difficult times at the moment. So typically Dr. Lee, my colleague here, and myself would do this talk in a nice large room. However, given the circumstances, we'll be doing it virtually today. So I am going to go ahead and jump right into my section of the talk, which is going to be an overview of symptoms of high blood pressure, the effects of high blood pressure on the body, and medications you can take and what you can do to control high blood pressure. So let's go ahead and get started. With regards to symptoms, right off the bat, I'm going to say, if you're looking for a list, you're definitely not going to find one. It's a pretty common myth that people think that, if you have high blood pressure, you have to be experiencing symptoms. Not true. That's why high blood pressure or hypertension is actually often considered still a silent killer, because you may not have, nervousness, sweating, difficulty sleeping, which people typically associated with having high blood pressure. So if you're ignoring your high blood pressure because you're waiting for a sign, you're taking a really dangerous chance with your life. I do not recommend that. Now, there is a situation called a hypertensive crisis, in which case you will have symptoms. But this is an emergency. This is a true call 911 emergency. If you are experiencing blood pressure that's above 180 with the top number, which is the systolic, or above 120 or both for the bottom number, which is diastolic, that is an emergency. And especially if you're experiencing headaches, nosebleeds, vision changes, chest pain, anything like that, you can wait a few minutes and retest. And of course, if you're still having those symptoms and experiencing and seeing those numbers, then I would suggest calling 911 and being evaluated right away. This could be a symptom of other health conditions as well. Now, there are a set of symptoms that can be inconclusive. There may be some association with high blood pressure, but they're not directly related to high blood pressure. The first being blood spots in the eyes. A fancy word for that is subconjunctival hemorrhages. So this we see, we do often see in diabetics and people with high blood pressure, but neither of these conditions actually directly cause the blood spots in the eyes. It just can be an association, but it's not a slam dunk. Facial flushing, right? People think, okay, if my face is flushed, the blood vessels in your face are dilating, then I have high blood pressure. Again, not true. There's a lot of other triggers associated with facial flushing, including, sun exposure, cold weather, spicy foods, the wind, hot drinks, various different things. Emotional stress, alcohol consumption, and exercise too actually can all increase your blood pressure temporarily, but neither of them are really a direct cause of the facial flushing or of high blood pressure. Dizziness, another really popular symptom people think is associated with high blood pressure. It's not caused by high blood pressure directly, but it's definitely something you don't want to ignore, especially if you're experiencing dizziness suddenly, if you have a loss of balance, if you have trouble walking. I would like to say that, these could be a sign of a stroke, something much, very immediate and serious. So it's definitely something to make note of. Now, let's get into what parts of the body and what health threats high blood pressure imposes on us. So various parts of the body are affected, and I'll go into each one directly. So the brain with the stroke, cause of a stroke, vision loss, heart attack, kidney disease or kidney failure, heart failure as well, and of course a popular one, sexual dysfunction. Let's get into the cardiovascular threats that high blood pressure causes. So heart disease, unfortunately, is the leading cause of death in the United States. And a heart attack basically is when occurs when damaged arteries, because of the strain that's being put on the heart, lead to plaque formation, which is, plaques are basically buildup of fat and cholesterol and other substances. And this process, this plaque formation, is called atherosclerosis. And of course, if one of these plaques forms a clot, which then essentially cuts off blood supply to the artery of the heart artery, leading to a strain on the heart and death of parts of the heart muscle, which is essentially a heart attack. Now, if this type of occurrence happens in the brain, again, similar idea where the vessels in the brain are blocked off by a clot, just like the clot we just talked about, then that is actually a stroke. And specifically, it's an ischemic stroke. However, you could also have the blood vessel actually burst in the brain, and that would be a hemorrhagic stroke. Unfortunately, strokes are the 5th leading cause of death in the USA per CDC, and still a leading cause of severe long-term disability. A majority of strokes are ischemic strokes that we see. If you go ahead and copy this link and put it into your Google bar or put it into your web space, you can see it'll take you directly to a nice video of an actual stroke kind of taking place. Okay, so another way that high blood pressure will affect your cardiovascular system is causing heart failure. So heart failure basically is a result of, again, an increase in the workload of the heart, which then leads to, over time, as you could see on the right side of the diagram here, an enlargement of the heart because the heart muscles are weakened and they can't pump enough blood. So that's kind of a simple way to put it, but that is essentially heart failure. Again, that increased workload is coming from the uncontrolled high blood pressure that the body is having to deal with. Okay. Kidney failure. Unfortunately, high blood pressure is actually the 2nd leading cause of kidney failure. It's pretty high up, reason up there, cause up there. The kidneys are our filter system. So whenever, you are eating, etc., these little finger-like nephrons that the kidneys have, that's what's filtering your blood. And each nephron actually gets their blood supply through these tiny hair-like little capillaries. Now, whenever the high blood pressure in your body is uncontrolled and an ongoing issue, arteries around the kidneys, they start to get narrow, they weaken, they harden, and they're not able to filter the blood well. In addition, kidneys are a huge part of how we regulate our blood pressure. They produce hormones, especially one called aldosterone, which helps regulate blood pressure. So when you have a damaged kidney, basically you're not going to be producing that hormone properly. And that's going to, again, contribute to a further uncontrolled high blood pressure. So it's kind of like this negative downward spiral as more and more arteries are affected. The kidneys will further not be able to control blood pressure, and then again, continued malfunctioning of the kidneys eventually will lead to actual kidney failure. Vision loss. So there are a couple of ways that high blood pressure, a couple of areas that it could target and affect our vision actually. Retinopathy is a common kind of form of blood vessel damage, essentially having to do with a poor blood flow to the retina. Again, from over time, uncontrolled, untreated high blood pressure. This can actually lead to complete vision loss. There's also a way where fluid buildup can happen under the retina. Now, the retina is the light-sensitive, layer of your eye tissue, and the damage to this can lead to distorted vision, and that's corneopathy. Lastly, there's a way where the nerve cells actually of the eye can get affected and lose blood flow, and this is optic neuropathy, and this will either temporarily or permanently lead to vision loss as well. So, of course, sexual dysfunction is something that is of interest to many people. High blood pressure that's over time uncontrolled for men will lead to erectile dysfunction or can lead to erectile dysfunction. It's obviously more physically apparent for men than women, just because of the way the mechanism of the body. So, if you don't have enough blood supply to the penis, essentially there will be lack of an erection. For women, what happens with a high blood pressure and an uncontrolled blood pressure, they experience lower libidos, they have less interest in sex, especially if that high blood pressure is contributing to them feeling fatigued. Here's a little cartoon for you guys. Luckily, we don't have to deal with erectile dysfunction. Okay, so now that I have brought up all of that and scared you all a bit, maybe, I would like to, in the next few slides, focus on ways that, high blood pressure can be controlled and can be, managed. I will say there's really no cure, right? But using medicines that are prescribed and making lifestyle changes can really enhance the quality of your life and reduce the risk of some of the things we talked about, including reduce the risk of heart disease, a stroke, kidney disease, etc. So here's a list here that I'm going to go ahead and dissect and get into. So we'll go one by one into each area of eating a well-balanced diet, how alcohol plays a role, physical activity, stress, etc. So let's get into it here. A healthy diet. So, a healthy diet, we all know generally what kinds of things that we should be enjoying and what kinds of things that we want to avoid. So we really would, want to focus on fruits and vegetables. We want to focus on whole grains, low fat dairy products, skinless poultry, fish, nuts, and legumes. And we really want to try to avoid saturated and trans fats. Sodium, of course, well, I'll get into details on sodium. Red meat, if you could limit it. If you do have red meat, the leanest cuts are preferred. Sweets, and of course, sugary sweetened beverages. There is a diet called the DASH diet, which is found on the American Heart Association website. I encourage you all to take a look at that. It's the Dietary Approaches to Stop Hypertension is the acronym that it stands for. And that'll give you a good overview of the type of diet you should follow. And then as far as something I want to bring your attention to is this heart check certification. So this is something come up from, by the American Heart Association as well. And I would like to say that if you do see this on a food label, then you can be sure that this product has been put through a robust certification process to be meeting the criteria for a heart healthy food. So if you're not into reading labels, I really suggest that you start to incorporate that into your grocery shopping, and you will pay attention. And when you pay attention, you will see this label, and you could be sure that, okay, this is a product that is okay for me to consume. Let's talk a little bit about sodium and salt, etc. So, many Americans, we have quite an acquired taste for a high salt diet. But I don't know if you all are aware that you're actually not supposed to have any more than 2,300 milligrams of sodium per day. And that's actually for somebody who does not have high blood pressure. If you can help it, actually, if you do have high blood pressure, you should limit it no more than 1,500 milligrams of sodium per day. If you even can cut down by 1,000 milligrams a day of sodium, that already will improve your blood pressure and your heart health. And just to put things into perspective, 1 teaspoon of salt already has 2,300 milligrams of sodium. So I'll go into some of these salty foods, but really reading your labels is going to be very eye-opening with how much sodium some of the things we consume have. So here is the Salty 6, and just to kind of let you all know, some of these things here may have the total daily amount of sodium you're allowed to have. So just be really cautious when you're buying these things, especially processed. So breads and rolls, Pizzas, we all love a frozen pizza here and there, but we have to be really, really careful. Sandwiches, cold cuts and cured meats, soups are a big time offender for having lots and lots of sodium. Burritos and tacos, especially if you're putting all the toppings, that go with it. Again, you should be very, very careful of consuming that type of food. Alcohol. So another kind of popular area people want to know about, if you have high blood pressure, can you drink alcohol? Generally speaking, people can drink alcohol. I definitely recommend limiting it though. I would even say less than what's on the slide here. You generally 2 drinks a day for men, no more than 1 drink per day for women is acceptable. But I would say, because drinking sometimes forms a habit of, continued drinking or needing more drinks. So I recommend people actually drink even less than that. And we're talking about a drink here like a 12-ounce beer or 4 ounces of wine, something like that. And something else I'd like to touch on here is the myth about red wine. That red wine is great for my heart and I could just drink red wine all day. However, red wine is not a miracle drink. The links of the reports of studies showing that, it is uh, helpful for heart health, this may be due to other lifestyle factors. So again, like any other dietary or lifestyle choice, it's a matter of moderation. All right, let's talk a little bit about physical activity. So physical activity is very, very important as well to maintaining our heart health and keeping our blood pressures well controlled. You want to aim for at least 150 minutes of moderate intensity activity per week, and brisk walking actually counts. And you want to try to spread it throughout the week. And look for something that you enjoy. This can be a variety of different things. You can mix it up. You want to keep yourself interested and engaged. You can include things like weightlifting, resistance bands, yoga, stretching exercises, etc. If you like the outdoors, for example, you want to combine it with exercise and enjoy the scenery while you walk or jog. Unfortunately, given the coronavirus pandemic we are experiencing right now, that may be what we are all limited to anyway because our gyms are closed. So make the best of whatever your situation may be and try to find some pleasure, and joy in exercising to make it become something that you do long term. I'd like to talk a little bit about stress, especially during these times when I think we are all experiencing added stress in various ways, and some of us more than others. Managing stress is going to be a very, very key part of also managing high blood pressure. There's definitely a link between chronic stress and blood pressure, and that's an ongoing study that is going on. Because stress, we do know that it leads to our bodies going into this fight or flight response and releasing certain hormones like adrenaline and cortisol, which actually raise our blood pressures. Generally, that's a temporary thing that happens. It's kind of an evolutionary thing, this whole fight or flight, to help us deal with certain situations. However, if you are in constant stress, ongoing, constant stress, your body kind of can go into this high gear fight or flight state for days and even weeks at a time. And that's what's kind of being studied right now. What are the long-term effects of that? We definitely do know stress is a contributor to a poor diet and excessive alcohol consumption. And we've just spent some time talking about how alcohol and poor diet is linked to high blood pressure. So it's only a matter of time that we can further delineate the ways that stress is connected with high blood pressure as well. Now, in terms of, how can we control stress, there's various different things that we could do. You want to be able to maybe change your expectations. If you're somebody who, has a hard time with time management, or you have a difficult time saying no and you promise too much, you want to be able to change some of that in your life. Reevaluate your priorities, make some choices to make your life more manageable for you, and recognize where you have control. Think about the problems in your life that you can control, that you could do something about. For example, if you're having difficulties at work, talk to your boss. If you have a neighbor's dog that really bothers you, well, talk to your neighbor. So get help when you have too much to do. These types of things are things that you can maybe have some control over. Take care of your mood. Relaxing is very, very important. Even if you can take 15 to 20 minutes a day to just kind of sit quietly, breathe deeply, think of something peaceful, that will help, just bring you to a place where you feel better overall. Practicing gratitude is also very important, and changing how you respond to difficult situations and focusing on what's the positive and not the negative can boost your feelings of feeling good about life and reducing those stressful thoughts. I think something I can recommend right now for all of us is, if you enjoy volunteering opportunities, and there's definitely lots of that available at this difficult time that we're all dealing with in this country. Let's talk a little bit about weight and managing weight. So there's definitely a connection with being overweight and having a high blood pressure. If you actually can lose even as little as 5 or 10 pounds, you may see already a reduction in the numbers of your blood pressure. And it also makes sense that if you have less weight, that you're carrying less weight, that will mean that there's a reduced strain on your heart. Smoking. Okay, let's talk a little bit about smoking. I know this is a tough area for many people, but I do want to emphasize that smoking, it's a very important preventable cause of premature death in the United States. It is a risk factor for heart attacks and strokes, and it's going to increase the risk for the buildup of those plaques that I talked about earlier inside the arteries. And also, when you do smoke, it does lead to definitely at least a temporary rise in your blood pressure. So there's a connection there with high blood pressure for sure. Okay, so other ways that we can control our blood pressure are medications, of course. So again, I'd like to emphasize that having high blood pressure, sometimes it is a lifelong condition. You may need to accept that you might have to take medicines for the rest of your life. And there's, of course, naturopathic approaches too, and herbs and supplements, and I'll talk about some of that. But those should not be considered as substitutes for medications that have been carefully studied and monitored and known to be very, very effective. So let's get into some specifics here. Over-the-counter medications and high blood pressure. So I'd like to say that there are definitely many medicines that can lead to higher blood pressure. You want to always read your labels. If you're taking things over the counter, consult your doctor. Be careful with the supplements. Sometimes supplements, they may not work the way they are advertised to. They may actually lead to higher blood pressure. So be careful with those. And specifically, I want to call out the decongestants. So things like Afrin, Sudafed. If you see a D, for example, if you buy Advil Cold and Sinus D or Claritin or Allegra D, that D stands for decongestant. So you want to be very cautious with that. Make your provider aware you are taking that, because that will raise your blood pressure potentially. And if you already have high blood pressure, especially uncontrolled high blood pressure, that could be something dangerous. Okay, let's get into other medications and other things that can actually raise high blood pressure. So we talked a little bit about alcohol. Specifics can also include amphetamines, antidepressants, atypical antipsychotics, caffeine, birth control pills actually. NSAIDs are also a big, big cause of high blood pressure at times. That's the nonsteroidal anti-inflammatory drugs, also known as things like ibuprofen, Advil, naproxen, etc. Recreational drugs are also can be some of the things that raise high blood pressure. Steroids also very commonly associated with high blood pressure, especially if taken for long term. So those are things like prednisone, methylprednisolone. So again, if you are taking those, you want to make your provider aware of what you're taking, and you want to make your provider also aware that you do have high blood pressure, because these drugs sometimes are prescribed by providers who are not your primary care doctor and who may not have a whole picture of your overall health. Let's talk a little bit about how we can manage medications. So very, very important points here. You never want to run out of pills, even for a single day, okay? And if you're trying to ration off your pills because you don't want to go to the pharmacy, or you don't have enough, whatever the reason may be, it's really not a good idea to be taking your pills every other day or splitting your pills. That could be very dangerous. I think that some people also need to accept that you may need more than one prescription. It may take a few pills because, as I'll go into in the next few slides, different medications have different effects, and sometimes they work together, also known as they work synergistically to better control your high blood pressure. Again, you want to tell all your providers about all the over-the-counters and all the prescription drugs you are taking, because you want to make sure that they're all aware of your current state of health. You want to be patient, because sometimes it does take a few trips to the doctor, or a few different trials of medications to get to the regimen that works for you. Make sure you keep your appointments. Don't skip any appointments, because you fall behind, and that makes it harder for yourself, and also later to catch up, and also for your physician. Please try not to go doctor shopping thinking, one doctor will give you, will tell you what you want to hear. It also actually makes it more dangerous and difficult to control your high blood pressure if you're seeing various different physicians. Also, I really recommend that you try to use one pharmacy. You want to be able to have all your drugs in one location, because that is what will make it safest for you. Your pharmacy needs to be aware of what is being prescribed to you. Sometimes it's the pharmacy and the pharmacist or their technicians who catch mistakes, doctors prescribing different things, different physicians. So they, if you have one pharmacy, you can go ahead and consolidate all of that. Let's get into the medications a little bit, types of medications. So there are many, many classes of medication. So I want to reassure anyone who's been recently diagnosed with high blood pressure, fret not, because there are, as you could see here, over a dozen options of different various drugs available. I'm going to just touch on the more popular and more commonly used ones in the next few slides. Let's talk a little bit about diuretics. Diuretics basically are the drugs that help get rid of sodium and water. And you may have heard of some of these popular ones like hydrochlorothiazide, chlorthalidone, furosemide, bumetanide, etc. They're actually often used in combination with other drugs. That's how they work most effectively. Now, because they get rid of sodium and water, they actually also get rid of potassium. So some of the side effects, unfortunately, linked with them are leg cramps, weakness, and some of that can be because of that loss of potassium. So if you are experiencing any of these side effects, I strongly recommend talking with your physician and keeping them aware of what you're experiencing. You may need an adjustment in medication. Gout attacks and impotence are also known to be associated with this class of drugs. Beta blockers. Let's talk a little bit about beta blockers. So, very, very commonly used drug. It's been around for many, many years. They actually work by reducing your heart rate and workload, which used to be thought to be counterintuitive. But actually, by doing that, they're lowering your blood pressure. Some of the popular ones are atenolol, metoprolol, propranolol, which you may have heard of. And going into just the popular side effects or the more common side effects, it can be linked to tiredness, feeling down or depressed. Sometimes it can actually make, if you have asthma, make your asthma worse. Also commonly reported are cold hands and feet. So again, these are the more popular, more commonly reported side effects with beta blockers. ACE inhibitors. So let's talk a little bit about ACE inhibitors, also very commonly prescribed medication. It stands for angiotensin converting enzyme. Now, angiotensin is a chemical that actually causes our arteries to become narrow, especially in the kidneys, but also throughout the body. So this will help your body produce, this drug actually helps your body produce less angiotensin, which helps the blood vessels relax and open up, and therefore lowers your high blood pressure. Now, the common ones which are popularly prescribed are benazepril, lisinopril, enalapril, ramipril. I'd like to point out some of the common side effects. This dry hacking cough, chronic dry hacking cough, very commonly reported. So if you experience that, you do want to let your doctor know. You may need a different drug. Rash can happen with this particular class of drugs, so be aware of that. In rare instances, there's a kidney damage that can be associated with this class. So again, you want to be cautious of these symptoms and report them right away to your provider. Similar to the ACE inhibitors are the angiotensin receptor blockers, or ARBs. Now, we talked about angiotensin as a chemical that is going to cause arteries to become narrow. Now, the way these angiotensin receptor blockers work is they just block the effect of the angiotensin. So again, by doing that, they will help your body lower the blood pressure. Common prescribed ones, candesartan, irbesartan, losartan. These are the popular ones. And one of the side effects that is reported is dizziness. So be aware of that as well. Calcium channel blockers, another group of very, very commonly prescribed medications. And this also may seem counterintuitive because these medicines prevent calcium from entering your smooth muscle cells of the heart and the arteries. But what happens is when calcium enters, it causes a stronger and harder contraction. So by decreasing the calcium, the heart's contraction is not as forceful. So you end up having less of a high blood pressure, essentially lower blood pressure. Some of the common ones are amlodipine, nifedipine, diltiazem. Very common side effect, unfortunately, with these can be swollen ankles. Constipation is also reported, sometimes headaches, dizziness, palpitations. Again, you have to try it out to assess what effect you have. You may not experience any side effects, but if you do, you need to let your provider know. All right, so we are at the end of the talk here, and I just want to emphasize that, the key with controlling your blood pressure is really taking a collaborative effort. You want to partner with your physician, you want to ask about your blood pressure at your visits, become somebody who is aware of your numbers and become a tracker, keep a log of your medications, your blood pressure levels, and have questions for your doctor. The American Heart Association website actually has some great PDFs that you can download and use to go ahead and track your numbers. This is the website listed here, www.heart.org/HBP. I got a lot of my information from this website. It's very, very informative. You want to also, of course, be very flexible. Remember that, it may take some time, it may take effort, various visits to get your blood pressure under control, and that is okay. At the end of the day, you want to know yourself. You want to be aware of what is keeping you from the goals that you're trying to achieve with your blood pressure. Is it the medicine? Is it, your eating habits? Is it your weight? What are your barriers to better your health? And talk to your doctor about them. And I assure you that your doctor, your clinic will have suggestions to help you out. That is the end of my talk. I thank you all for being present, being here. I'd like to also give a special thank you to our true warriors of patient education, Beth Sobel and Nare Devuti, and also all the people listed here. And again, thank you for giving me this opportunity. And I hope to see you all at the next talk.